in volume 2, you'll see that the technique takes place like this, and the arm's on the side of the head, and that happens like this. So that we force the correct side bend, we introduce rotation at this level with our hands here, and the whole of the neck is levered on, and I think that is very bad. I think we should stick with this being firm and only use rotation, and then presumably the correct side flexion will occur at that level. So I would suggest this is not to be done. I've seen some of my more esteemed colleagues, not the ones I sort of work with here in the Institute, but certainly the ones I've worked with elsewhere, that actually sort of get a very big crack, but the neck is taken down here and it's extremely sore. So I think the technique we should use is this. We should take the head into side flexion, rotation down until you feel that it's arrived at my thumb here. And my thumb now is wanting to move this way. That means that I've arrived at the stiff joint. So if I'm doing T1, T2, I'm on T2, the left-hand side, to stop right rotation occurring at 2, 3. As soon as 2 starts to want to move, I know that I've gone through 1, 2. So I keep it at that point. I do not let my thumb move. So I come into a position here, and I'm going to take my hand round the neck, avoiding the chin. I almost had my jaw dislocated on the first course I did doing this technique, okay, by someone who came in here and was very keen to sort of produce the crack, and did get a crack, but it was in my temporomandibular joint, and I had a very sore joint for about 3 weeks. Okay, so you have to be careful with this. So I want to be around here, around there, and I'm nowhere near the jaw. I'm coming over the maxilla. Now, I don't know whether the cranial people are very, very worried about me moving the maxilla. I don't know about that. All right, so I'm coming into here. My technique is going to be to hold it there and then to give a little impulse through my thumb there. So, and that would be the technique. To come down and a little rotational impulse which gapped this right-hand side joint here. And you see that I was in every way supporting that head. I give a little traction to the head, to the neck too, to try and disengage, or not disengage, but to stop compressional forces in the neck. And I make sure that I stay not above like this, so there's any tendency for me to do that. The tendency I've got to do is that movement there. So I'm pushing through on the spinous process of T2 to produce a rotation to the right, because I'm actually producing a rotation to the left of T2, which means it's a right rotation of T1.
So you're getting the gap
on the right-hand side. It gaps those facet joints. So this is this technique done in sitting.
So you're trying to manipulate T1, 2
into right rotation, gapping the right facet. All right, let's do that first. And then we do the variations in lying.
Are you trying to restore left rotation?
No, right rotation. For the T3, possibly the T2, but certainly the T3, T4 area, using your knee. Why am I doing this? A, because it's a very efficient technique, and B, because you're going to see it in books, and I'd like you to do it properly if you're going to do it at all. Now, this is one of these techniques that puts your back under risk, but usually you do it so quick in terms of doing it that it impresses patients.